Hello, everybody. I am Krista Reimel. I am here today to introduce you to our next medical expert speaker. We're excited that we have Dr. Kristin Lockhart with us today. I'll start by sharing a little bit about myself. I am a registered nurse, a former healthcare administrator, and I am the founder and co-owner of The Point Retreats. The reason I'm doing these short series of interviews with different medical experts is because I want to make sure that we get information out to people that is factual, coming from local healthcare providers who are in the front lines, but we're really trying to give you information that is not centered on sensationalized or fear-based mass media information. These are really organic, real conversations with people who are seeing what's happening out there on the front lines. Because I am talking to medical colleagues and experts, I do want to put a couple medical disclaimers out there. Please recognize that what Dr. Lockhart and I are speaking about today is relevant to what we know today. The situation is changing frequently, so we are discussing what is known as of today. And if you have any questions specific to your healthcare needs, your particular personal history, please reach out to your own primary care clinician for personal medical advice. With that being said, I would like to introduce you to Dr. Kristin Lockhart. I'm going to let you know that Kristin has come to a couple of our retreats, and now she's turned into like our medical expert spokeswoman. So I'm not sure if that's what you intended to happen here, but I'm really grateful that you're here with us today, Kristin. And I'll share with our followers that both Kristin and her husband are both physicians, and they have 3 young children. So they are both very busy. And on top of that, Kristin did a delivery last night. So she's here with us despite being up most of the evening, taking care of a new mom delivering a new little baby. So thank you for being here with us. It's very appreciated. So with that, if you can let everybody know, introduce yourself and let everyone know what kind of medicine you practice.
Hi there, Krista. Thank you so much for the kind comments. I really appreciate this opportunity to be able to speak with you and hopefully deliver some helpful messages to people in the community. Again, I'm Dr. Kristin Lockhart. I'm a family medicine doctor, and I work for mHealth Fairview at their Oakdale location. I've been in practice for about 16 years now. A big part of my practice is young families. I take care of pregnant patients. I do deliver babies, and then I take care of a lot of those babies as they're growing. But my practice includes people up and through 100. So I have a wealth of opportunities just to meet with different people and experience healthcare in a lot of different ways.
Mm-hmm. Which is a really needed perspective right now, because I think we have a whole population globally that's going, what does it mean if I'm 5 or if I'm 15 or if I'm 45 or if I'm 75 with what's going on. And so you bring that overarching expertise of, taking care of people throughout their health span that is really appreciated right now. And as we were preparing for our talk and you shared that you delivered a baby last night, my initial reaction was like, oh, I love hearing about a baby being delivered and, just the joy that comes with that. But I think the reality of women and families who are having babies right now is it is probably a bit of a scary time to be delivering. So if you're willing to, Kristin, share a little bit about what you know today about what are the risks for your OB patients and the new moms and babies that are that are delivering.
Absolutely. This is really something that we're working on quite a bit to figure out what the parameters should be, what things should we really be worried about. ACOG definitely considers pregnant patients to be of high risk, although when we look at the numbers, we're not necessarily seeing that they're being infected at a higher rate. Mm-hmm. And while we definitely see that with influenza, we haven't yet seen that with coronavirus. And we also haven't seen that in the newborn population. So it's interesting. We want to treat these patients with care and be particularly attentive to them, but don't necessarily see that they are highest risk. Mm-hmm. We are paying a lot of attention to right now what's happening as patients are coming in through labor and delivery, and seeing if they're potentially either positive for the COVID-19 or if they are displaying symptoms that could represent that, sort of more of a person under investigation is what we call them.
Sure.
And we do this for a couple of reasons. Number one, we want to protect everyone that's in the hospital, other people that are having babies. This is a really joyous time, and we want to keep it that way for everybody, make sure that people can stay healthy. We also want to make sure that we can keep moms and babies safe during this time frame.
Mhm.
Again, while we feel that for the most part, younger people and including newborns are going to be protected, we
Mhm.
don't want to take that risk that we would still have that happen on our watch.
Right.
So one of the things that we're looking at is there a right time for patients to be delivered? Should we be trying to get patients delivered earlier?
Mhm.
Meaning after 49 weeks, definitely at term, or excuse me, 39 weeks or at term. And what are we going to do when they show up for delivery?
Yeah.
Um, there are some parameters that are being put in place for people that either have symptoms, potentially could be carrying the virus, or actually are positive. And right now, we're actually recommending some isolation of the baby from mom after delivery
Okay.
once they do deliver, if the
Mhm.
mom is potentially contagious. This is a really tough thing. This is not anything that any mom really wants to think about.
Yeah.
But again, we're really trying to work to protect those newborn babies.
Absolutely. I know I've heard kind of some different, windows of time. Is it a couple hours? Is it a couple days? Is it, the 2 weeks that mom and baby are, being separated? And from our conversation before, it kind of sounds like it's a little bit case by case right now. Is that what you're
That is
understanding?
true. I think the biggest situation in which it's case by case is sort of what happens when they're not in the hospital. In the hospital, I think we're pretty clear that we're going to try to keep them separated if possible.
Okay.
Um, if it's not possible, or we feel that this is a situation that we can keep them together, we're still looking at wearing masks, gloves, and possible transmission to
Mm-hmm.
the baby from mom.
So if a mom comes in with suspicious symptoms, because here's again kind of one of the problem pieces of our current capacity to test is there's a 72-hour delay between testing and
Yeah,
results. And you can't
right,
ask a mom, can you just hang on for 72 hours till we know, and that doesn't
right.
work with a delivery, it's going to be a matter of hours. So you just have to take the precautions. So meaning you as her doctor delivering, you are fully protected, and then
Correct.
all of the staff in the room have to be protected. And then I would imagine, are the staff, like the nurses, then caring for the newborn for the subsequent hours and days? Do they have to still wear the PPEs and protective equipment with baby?
As of right now, that's what we're doing. We're almost considering the newborn also to be an unknown. And
Okay.
so we are still wearing that protective equipment with the newborns
Okay.
as we're, working through this. And yeah, absolutely. We are trying to limit the number of staff that are coming in.
Mm-hmm.
One rule across the board, whether or not you have COVID or are under investigation for it or have symptoms, is that we're limiting the people into hospitals at all. So when
Sure.
women come in laboring at our facilities, we're recommending one support person be
Okay.
there. And that's the same person that will stay there the
Sure.
entire time.
Sure. Sure. Makes sense to absolutely limit that exposure. And Um, do you, from again, what you know at this time, can moms who say do have COVID-19 or suspected COVID-19, are they still able to pump and possibly
Absolutely.
get breast milk to baby that way?
Definitely, we want to facilitate breastfeeding. We know breastfeeding to be one of the best ways that we can protect our babies, that we can feed our babies. We really want to support women in their breastfeeding no matter what.
Yeah.
So if they're unable to be with their baby, we're providing pumps,
Okay.
getting them pumping, getting their milk supply to come in and secure so then we finally can reunite mom and baby.
Yeah.
It's ready to go.
Oh, that's
Um,
good to hear.
yeah.
Yeah. How about, so I know you mentioned, a lot of moms are saying I'm, at that, 38 to 40 week window, gestational period. I want to deliver. Will you induce me? I mean, what's your kind of take on that right now? Are you like, no, let's not panic and start, inducing everybody? Or are you saying, it's reasonable to consider that right now?
Well, I think there's lots of conversations, and I think you'll find lots of answers depending upon who you really talk to. And so I would say it's definitely on a case by case basis.
Sure.
Um, 39 weeks is sort of my own threshold for when I'll start considering it. And right now, I'm personally open to trying to facilitate those deliveries in a safe manner. But there's a lot of things that we take into consideration when we're doing an induction. And so all of those factors, aside from COVID, would definitely come into play with decisions. And the main thing for people to hear, those, there's not a right answer right now.
Yeah.
Go to your doctor, go to your provider, see what they recommend. They know you best. They're going to know what's best for your scenario, and trust that they'll guide you through this process as safely as we can.
Yep, 100%. And this next question that I'm asking, again, there's so many different variables in this that I know it's going to be most important that someone reach out to their OB provider. But
Correct.
let's say you're 20 weeks along and you develop symptoms of COVID-19. What would you recommend for that mom to do?
First thing is that we're recommending for everybody: isolate, take care of your symptoms, but call your provider.
Yeah.
Call your provider to see if there's anything in your own history that would make this a different case. Do you have underlying asthma? Do you have some other things that we should be attending to? And also just see what their recommendations are. But for the most part, it's the same thing as it is with anyone else.
Okay.
Isolate, take good care of yourself, make sure that you're continuing with your prenatal vitamins, your good healthy eating and fluids, and definitely be in touch with your provider.
Yeah. Okay. Thank you for that. Yeah, this would be a little bit of an unsettling time to be expecting and approaching delivery. So I think, just hearing from you on this topic is really important for women today to just know, it's kind of about what can we do? What steps should we take versus sitting in that place of, fear and unknown. So just having your expert voice, give some answers to those questions is really helpful. So thank you for that.
Yeah, I think it is important for pregnant women to please don't panic right now. We are not seeing that pregnant women are severely affected by this. You do have that opportunity to, while you're staying in contact with your providers, be able to comfortably stay at home and take care of your symptoms if they're mild. And you're not showing any of our really concerning symptoms. That is okay, and more than likely you are going to do just fine. We're not aware of anything right now that would adversely affect the baby in this scenario, other than just trying to keep mom as healthy as we can.
Sure. And that's really reassuring to hear. So thank you for sharing that with all the women who are, not knowing what to do. And I don't know how much information is actually out there about the expecting population, because we're so focused on the elderly comorbidity population for justifiable reasons. But if I was expecting right now, I'd want to hear some kind of general words from an OB provider, and say, what am I supposed to think and do, and how, what should I feel right now, and so it's nice to hear that the majority of women, it's you're gonna treat just like you would the general population, and not expecting any big consequences or concerns coming from expecting or delivering at this time.
One of the things that we're also working on is trying to potentially, if appropriate, scale back on the number of times that you need to go to the doctor. Can we safely do that? Because we know that any outside exposure, especially in a doctor's office, could potentially raise your risk for contracting it.
Sure.
So don't be surprised if your doctor is recommending potentially less visits or an alternate way to just monitor you during the pregnancy. We're looking at this really intently and trying to figure out what's the safest thing to do for this population.
Right. And that makes sense. Again, for expecting moms to limit their exposure. And if you're not a high risk pregnancy, does it make sense for you to be putting yourself at more risk for in-person visits, where maybe you can do a virtual visit or some kind of alternative way of communicating with your provider? So yeah, that's good to hear. I hear throughout these interviews, I'm hearing so much creativity in the healthcare profession, which is dynamite. Nurses running out to parking lots to triage, and a lot of telehealth right now. And I think I applaud the healthcare community for for finding alternative ways to keep people safe, and really out of the clinics as much as
Mhm.
possible. So that's good that the expecting moms are having some creative ways to still get treatment. So thank
And
you.
one last thing I'd like to say
Yeah.
for expecting moms, if you end up delivering during this time frame, we are recommending less visitors for you for the baby at the hospital, but then also potentially at home.
Mhm.
And this can feel sad, it can feel a little isolating, but the real positive thing is it really is there to facilitate a calm bonding. Some people are really enjoying this opportunity and freedom of just being able to enjoy those first few days after the baby's born. It's peaceful going home and just being able to have that freedom to really say, okay, I can stay at home. I
Mhm.
can just enjoy and really relish in this time because it is a really beautiful time.
Yeah.
So if there's any real positive that I can see from this, I would say that is one. You don't have to feel bad about telling visitors not to come.
Mhm.
It's kind of a given. And
Yeah.
so if anything, try to enjoy that time frame if you were one of those moms that are at home or can't have visitors at the hospital.
Yeah. You know what? That is a really great point to make and to share, because oftentimes as a new expecting mom, and granted everybody's different, you have this flood of people that want to swarm you and baby with all really good intentions. And sometimes that's welcome and sometimes it's not. And now you have a really good reason to be like, I'm sorry, have you heard about this thing called COVID-19?
Right.
I really would prefer no one be around my baby. And you just get that kind of quiet, peaceful house. And, it doesn't matter if you've got 10 loads of laundry hanging in the background because no one's coming over anyways.
Exactly.
So just kind of relish in that, because once all of this lifts, I'm sure you're going to have a whole tribe of people that are going to want to
Right.
swarm in. So take advantage of the calm and the quiet, and catch up on probably some much needed sleep as when you can. So
Exactly.
yeah, thank you for that. I didn't know that's where our conversation was going to go today, but I am
Didn't
grateful for
either.
that little baby and mom that came into the world last night, because
Yeah.
it's led to this conversation this morning, and I think this will be really important for a lot of expecting parents to hear. So thank you for that, Kristen.
Absolutely.
And kind of taking it from that, birth spectrum of what you see and care for in your practice, now to kind of map out, kind of the other ages and how they're being impacted over, one's health span, and what you're seeing. How are the pediatric patients, you know, what are they kind of symptoms are they developing, say, versus kind of the adult population versus the high risk population? If you don't kind of mind walking us through that spectrum of age and what you're seeing and hearing about, that would be great.
Yeah, absolutely. And this is fascinating, I think, to most people that really, truly, we're seeing this population that with a lot of other diseases, including influenza, they're being
Mhm.
spared.
Mhm.
They're not getting as sick, which is wonderful.
Mhm.
So we have our infants and our children, and they, for the most part, are experiencing more cold symptoms.
Okay.
They're not getting severely ill, unless, of course, they have some more compromising underlying health conditions that would make them susceptible. But for the most part, our healthy kids are able to fight through this just fine. And it's fascinating to see what they're learning about why that might be the case. And there's lots of researchers out there that are trying to figure it out. Is it the immune system? Is it just the fact that they've got new healthy lungs that are there to be able to combat? And I don't know that we've got a definitive answer, but they're definitely working on it. So across the board, for the most part, we're seeing a sparing of really severe symptoms in our kids.
Thank
Doesn't mean they're
goodness.
not getting sick, doesn't mean they don't have it,
Yeah.
and certainly doesn't mean they're not harboring the virus, because a lot of times they are.
Yeah.
So
Yeah.
but it does mean that they're not going to get sick with it. That being said, they can also be a vector for transmitting it to
Mhm.
people.
Mhm.
So that's that population.
And can I ask you one question before we
Sure.
move on to the next one? So, influenza, so COVID-19 seeming to be a much milder
Mhm.
illness in the pediatric population. How does that compare to influenza A and influenza B and our seasonal influenzas? How's the pediatric population impacted by influenza in general?
In general, they are considered one of our highest risk. We see that very quickly influenza can overtake their bodies, and so they're put into the high risk category for influenza for sure.
So it's a really big discrepancy between the two viruses, which is so
Absolutely.
fascinating. I mean, and thank goodness it is that way, but really
Right.
fascinating. So like you, I'm following and really intrigued with the theories that are being, tossed around in terms of why this might be. And it will be interesting what happens in the, what's discovered in the next year or two around this. So um,
Absolutely. The pediatric population and the pregnant women who are typically considered very high risk during influenza, we just haven't seen them hit as hard with
mhm.
COVID versus we are seeing that consistency. The elderly population, the ones that we know are also really at risk for influenza, are also at risk for this too.
COVID, yeah. So do you mind kind of speaking through the other spectrums, like the average adult, and then moving into the geriatric population and high risk populations?
Yeah, absolutely. The average adult is probably going to have cold symptoms, flu symptoms. They're really hard to differentiate, to be honest with you.
Mm,
And they may get a little sicker than what we see with kiddos,
okay.
but they are not necessarily our highest risk either. What you can kind of see is if you track the numbers as you get older, you're just a little bit more susceptible.
Sure.
So each category as you get older puts you at higher risk.
Mm-hmm. Yep, and that makes sense. What about, so, I still get questions about high risk, defining high risk even in the adult population.
Yep.
Who is that? I've had a lot of questions from, I have a family member that has MS. Are they high risk? I have a family member that had cancer. Are they high risk?
Mhm.
I had a family member who has high blood pressure. Are they high risk? So who
Right.
is in that high risk category?
So clearly, we know anyone over the age of 65, people that are in nursing homes, group homes, those people are going to be more high risk for sure. So that's hands down. Um, Adults that have more debilitating illnesses, MS would certainly fall into that category. Severe lung disease, heart disease to the point where your heart is actually compromised.
Mhm.
We'll see that those people are definitely going to be higher risk.
Okay.
Diseases that affect your immune system. So, cancer, if you're undergoing chemotherapy, you're going to be considered immunosuppressed and be at higher risk.
Mhm.
Other populations that the immune system is suppressed, you'll see that too. But yeah, absolutely. Those are the categories that we're going to see. The average person with just high blood pressure,
Yep.
probably not a big factor
Yeah.
for them. We almost have to see some sort of problem with just the structures that we're dealing with, lungs, heart,
Mhm.
as opposed to just high blood pressure or just high cholesterol.
Sure, that makes sense. What about asthma? So what if someone has moderate to severe asthma, not mild asthma, but more kind of that moderate to severe, like they're doing regular treatment
Mhm.
to manage their asthma?
Yeah, I would put them in the higher risk category.
Okay,
Once their airways are inflamed, the asthma takes on a life of its own.
okay,
And so, if that asthma is likely to be flared by something like an infection, then absolutely they're at higher risk, and we want to make sure that we're protecting them.
okay. What about type 1, type 2 diabetes? Are they falling into the higher risk category too?
I think honestly, what we typically see is it really depends upon how well controlled you are.
Makes
If
sense.
you're otherwise very healthy and controlled and taking able to fall into that category, then you're going to be less at risk. When blood sugars are high, we know that we're more vulnerable. And so I think it's a really important time for people that have diabetes, whether it be type 1 or 2,
Mhm.
to take as much care as they can to control those numbers.
Yeah,
That being said, at baseline, for sure, they are a higher risk category,
sure.
especially our type 1 diabetes and even those children that have that. We
Mhm.
want to make sure that we're taking care to protect them.
Yeah, no, I thought about that too with a couple of type 1 kiddos that I know, just, trying to do a little extra to protect them right now. And
Absolutely.
it's this tough, kind of dilemma when your blood sugars are high, you know, um, other illnesses tend to take a stronger presence in your body. And so
Yep.
as much as those who have diabetes can try and keep their blood sugars within their normal window and their range,
Right.
the better off they will be. And I talked to a pharmacist yesterday, and my one concern is with a lot of people who are taking life saving altering medications like insulin, with the change in the economy and jobs and all of that, I just don't want to see people stop taking their insulin. So if that is something that is of concern to you, I would say please reach out to your primary care provider, like Dr. Kristin, and she and her staff can help get you resources, as can the diabetes educators, endocrinologists, pharmacists. So if that's coming into play here, I just want to put that out there to that population.
Well, I want to speak a little bit to that, not only with insulin, but a lot of other medications. We are working as healthcare organizations to keep people home. Some of that means foregoing some of your routine appointments if we feel it's safe to do so, and extending refills of these medications to you. So if you get a notice that says you need to have an appointment, maybe check in with that to see that that's actually accurate for today in this point in time. We are making every effort to maintain people on their medications, whether or not they're able to make it into the office. If we feel like it's necessary that we need to evaluate them, we're going to make every effort to get them in. But in a lot of cases, we're actually doing the opposite. We're making every effort to keep you home, whether it be through phone calls, e-visits, things like that, so that we can continue to keep you safe and keep you on your medications. It's really important during this time.
That is important to share with everyone, because so often people now become accustomed to, I won't get my refills if I haven't seen my doctor in X amount of time. So again, the healthcare systems are being creative to protect you and to protect them. And don't just assume that you have to make that appointment. If check in and see if you really need to, and you very well may not at this time. You can still get X amount of refills without being seen in person. So yeah, that's great to share. And how about then moving into the high risk population? What kind of when should a patient who's high risk reach out to their healthcare provider and or go into an emergency room?
So we have a great system in place. If you're high risk and developing systems, we want you to engage fairly quickly. One of the really tough things about this virus is that it can cause you to go downhill fairly fast. And so we want to know where you're at the time, be able to assess some of your risk factors to decide how to direct you. So we have a system through Fairview, it's called OnCare, where you can call in and you actually get to talk to someone, and they can give you advice at that point in time to decide what makes sense for you. Some of it is going to be home care. Sometimes you're going to be directed to contact your clinic. And there are going to be times in which we do want you to present to the emergency room. The most sentinel symptoms that we absolutely want you to present or be seen are going to be with any significant respiratory compromise. If you're struggling to breathe, that you're going to need to be seen. If you are having chest pain along with that, or chest pain period, we're going to need to see you. Other signs can be that if you're noticing that you're either pale around your lips, a little bluish discoloration, that could be a sign you're not getting the oxygen that you need. And then finally, if you're not able to sustain yourself, you're not able to eat, drink, becoming very lethargic, or any confusion, you need to be seen. It's great. We have triage systems if you just go directly to the emergency room, or they can triage you. But if you have an opportunity or someone who can alert the staff where you're going, try to do that. It allows them to have that preparation for your arrival so we can get you the most immediate care. And so that's kind of the biggest thing that we're trying to encourage the public to do. Try to call ahead so that we can best find the place for you. In an emergency, you need to get where you need to be. In most other cases, sometimes it takes a little bit of patience with either the triaging systems or lines or someone to get back to you. But please try to be patient with that, because we are trying to get you what you need and at the right location.
That's really good advice. You did a really nice job of giving those comprehensive symptoms of when someone, should go in and seek treatment. And alerting ahead of time if you're going to come in with COVID-19, symptoms. Who would you alert? Like, how would that look like? Like, call your primary care clinic and just let them know you're heading in, or whom would you call?
That would probably be the best entry point.
Okay.
Is calling your primary care clinic. Now, obviously, if you're calling 911, you can alert them and they will take it from there. So if you're that urgent, still call 911, do what you need to do. They will take it from there. But otherwise, most clinics will have a triaging system where if you call the clinic number, you're going to be able to talk with someone pretty quickly, and then they can direct and then help you to help to alert the facilities.
Which is wonderful. It sounds like overwhelmingly the healthcare systems in the Twin Cities sound very prepared, which is great. I mean, I know a few of them are getting hit a little harder than others right now, but that's kind of the ones that are getting hit harder that I'm hearing about, are the ones that typically do. I'm really impressed with the healthcare systems locally, though. They sound very well prepared. And, so with that being said, to not overutilize and overexpose our healthcare population either. If let's say I get mild cold symptoms, I have a mild fever, I'm just feeling kind of punked. Would it be wise for me to want to come in, and will I get tested? Or would that be the patient, me, where you'd say, you know what, you're fine, you're healthy, stay home, we don't need to test you? I mean, what should the average person do with more mild cold flu-like symptoms?
Absolutely, right now with mild cold and flu symptoms, stay home. If you can manage, you're doing fine. Take care of yourself. Isolate from people that you could potentially pass it on to, and wait it out.
Mm-hmm.
We're not going to be doing a lot. We don't have the resources right now to do testing at this point in time, which I expect this to change, but at this point in time, we're only testing the sickest people in the hospital, and potentially, but not always, even healthcare workers.
Sure.
So doesn't mean that we don't believe that you could have it. Doesn't mean that we aren't concerned, but rather it's not going to change what we're going to recommend or do for you.
Right.
It's going to be that recommendation: stay home until your symptoms have recovered, until you're fever free. If there's things that we can help you with as far as helping to control those symptoms, then place a phone call to your clinic. But if for the most part you feel like you can manage it, try to do that.
Yep. And if you do happen to show up in a clinic, and please confirm if this is correct, and you are a relatively, you're a healthy individual with mild symptoms, they're not going to test you anyways, because they just don't have enough of them. So then you've kind of put yourself in harm's way by going into a clinic where, there's not just potentially COVID-19, but there's strep and there's influenza and there's all kinds of other things that you don't really want to walk away with either. So I think that's an important message to get out to the general public. If you're healthy, you're otherwise doing okay, your symptoms on the more mild side, it's reasonable to stay home, and you might not ever know if you had it. And that's okay too. I mean,
that is okay. I think that's hard for us as a society. We just want to know, and especially with something that's created such a widespread sort of involvement and panic, that what we're seeing, people want to know, did I have it? Do I have it? At this point in time, trying to be okay with the fact that I might have it. I'm going to treat myself potentially even like I do. And also be aware that not even all facilities even have the ability to test. So in telling you we're not going to test, some of it may just even be, we don't even have it there, which is another reason to call ahead so that you can figure out where is it.
Yeah, absolutely. And remember, all of those other same, illnesses are going around now that have been going around for many, many years. So, that's another good reason to call and have your healthcare provider help you triage, your symptoms, something that would require you to come in. And even my kiddo had a sniffly nose. She's like, do I have it? I'm like, I don't know. I'm like, but the bottom line is you're fine. You're walking, you're talking, you're happy, you're playing, you're eating, you're drinking, you're sleeping, you're breathing, you're fine. So, don't panic that you have to have this confirmation of I have it or I don't. Many of us are going to have it and we don't know, and we never will know. And that's quite all right, because bottom line is your body fought it. Whatever you had, it fought it, and you're fine.
Yes, absolutely. I think that's definitely a message.
Yeah. So, Kristin, what are you doing right now for your health and your family's health? How are you protecting yourself, being a frontline healthcare provider? And then I think what, I like to bring to light to people is the risk that our healthcare providers are taking right now in their profession. I mean, you're called to treat people who are really sick, and that not only exposes you, but that also, you go home and you expose your kiddos. So how are you staying healthy and well right now, and your family?
Well, I always, in times like these, sort of result to or go back to the basics. We want to make sure that we're eating healthy. We want to make sure that we are sleeping and taking care of ourselves that way, getting some exercise in kind of a safe way. For myself, as far as going into the clinic, making sure that we're aware of who's coming in, sort of assuming that it's going to be out there and protecting ourselves in ways that we can, using our protective equipment when appropriate. When I get home, taking off any clothing that I have to make sure that I'm not carrying that into my home, and then just being with my children in normal ways that
Mhm.
anyone else would. So
Yeah.
we are isolating. My kids are not in school like everyone else is, and we are trying to really limit exposure to other people. We're not doing play dates. We're not doing sleepovers.
Mhm.
We are just trying to enjoy this time as a family.
Yeah, that's great. And it's, I know you run around after hours with your kiddos like crazy, and I'm sure have had those nights where you're like, oh, I wish I could just have a night at home, and trying to just,
Mhm.
seize those nights that we do know I'll have at home, or days, and trying to make the best of
Mhm.
them. And speaking of your kiddos, I know they're having a breakfast party as you're in one room of your house on this Zoom call with me, and your husband, who's also a physician, is on another room on a Zoom call with someone else. And so I don't want to take up too much more of your time, but is there anything else that you want to share? And I keep calling you Kristen, it's Dr. Kristin Lockhart. Dr. Lockhart, is there anything else you want to share with the general public that you think they need to know?
Well, more than anything, I really want to thank people because I have seen a huge community response to this. And people are hearing and they're understanding that most of the time, young children or families aren't necessarily affected, but they understand that by staying home, they're protecting our most vulnerable in our community. People are making sacrifices. Parents are staying home from work with their kids and trying to work from home with their kids. It's a huge sacrifice. People are not going on their trips. They are avoiding eating out and avoid canceling weddings, big things like that. And
Mhm.
it's a sacrifice. Everyone is making sacrifices, and I'm so in awe and inspired by our community as we're coming together like this. So I want to thank people for making those sacrifices,
Mhm.
and also obviously just continue to support those healthcare workers, especially our frontline ER doctors, our ER nurses, all the ER staff, really, our first responders, all those people that are really just constantly put out there frontline. And just support them in any way, whether it be through words or any other way that you feel you can. And right now, probably the best way we can support them is by trying to be sensible, take care of ourselves at home if we can, and really mind the recommendations to just distance ourselves right
Mhm.
now, at least physically. Doesn't mean we have to. Socially, there's lots of ways. We're so blessed right now. So
Yeah.
take advantage of those ways and keep doing what we're doing. We're gonna get through this because of the great response that we're seeing from people.
Hmm. Really, it's, I would say I'm just kind of humbled by the fact that you're, thanking the public too, because I, feel very grateful for all that the healthcare professionals are doing. So thank you for recognizing what the public is trying to do, and recognize that Dr. Kristen is one of the reasons that you're doing it. It's your high risk population, but it's also healthcare providers like her, because we don't have, hundreds of thousands of them, and she needs to see very likely hundreds of thousands of patients within, a year's time. So we're everyone is doing what they can, to really protect you. And Kristen and I know each other really well on a personal level too. And we created a little virtual social gathering the other evening, and it was really fun to just see our friends, kind of like this. And you can still be creative and connect in ways like that. So don't, forget that, there's creative ways to still connect with people during this time, but yet still continuing to protect our high risk population and our healthcare providers. And I guess I would ask, the public, if there's anything that you can do for anybody in need right now, but in particular your healthcare professionals. If you know a nurse, a doctor, a respiratory therapist, x-ray tech, whatever, anybody who's seeing patients right now, just, put a bag of coffee on their doorstep, leave, a little thank you note, but just remember that they're putting in a lot of hours right now, as I'm sure Dr. Kristin got very little sleep last night as she was delivering a baby. But, you know, healthcare providers are really honorable people doing really honorable things right now. So, Kristin, thank you from the bottom of my heart for sharing your wisdom and your time with us this morning.
Thank you, Krista. I really appreciate it.
Yeah, thank you. Okay, we'll talk soon. Goodbye, my friend.
Okay.
Bye-bye.
Bye.